So,
Yeah.
Doctor, let's talk about the CDC, and particularly, I want to play part of what Dan Jernigan had to say. He's one of the officials who quit after the Trump administration targeted this CDC director. Take a listen.
I've been at CDC for over 30 years and doing lots of different infectious disease outbreaks, et cetera. I've been through a lot of administrations, including the first Trump administration. This is different. The character right now is one of questioning, of a lack of respect for the science, and an approach that really is looking to find answers for things where there might not be an answer.
So that's 30 years of experience, Zeke, that's gone. And it's safe to say that he, along with the others who left, are among the foremost experts in their fields. How hard is it to effectively run an agency when you lose leaders like that and all at once?
Oh, they're not trying to run an agency. They're trying to totally undermine the agency and get the agency to do what RFK Jr. wants to have happen. It's not just turmoil, it's destruction. They have reduced the amount of data they have. They've pulled off their website data that the public could get. They are issuing guidelines about vaccinations that don't comport with the science. That's what led to this latest outbreak or the latest set of resignations. This is, I don't think we're at the start. I think we're well into the play here of dismantling the CDC as we know it. I think a lot of pressure has to be on Senator Bill Cassidy, who heads the HELP committee, that's Health, Education, Labor, and Pensions, and has oversight here. And he supposedly claims he got an ironclad letter from RFK Jr. before he voted for him for confirmation that he wouldn't disrupt vaccine policy and vaccine approvals. That is clearly RFK Jr. is disrupting it, trying to totally undermine the oversight of vaccines and the using science to determine which vaccines should go and which patients should get them. This is a very serious issue. Many thousands of Americans will end up being harmed by this. Some will even die. I don't think this is trivial. And Senator Cassidy has to draw a line, and he has to say very clearly in the appropriations bill for HHS what he expects, including reconstituting an advisory committee on immunization policy that has scientists and not simply anti-vaccine advocates who are intent on not following the science and dismantling the regime that we know that has given us safe vaccines, many of them.
Well, what are the chances of that, Vaughn Hilliard? I mean, if indeed, as Dr. Emanuel has said, the goal here is not turmoil, and we talk about how Trump likes to create chaos, but if the goal is not turmoil but destruction, tell us what's happening from the White House perspective.
Well, just yesterday from the podium of the briefing room, Caroline Leavitt was asked about these firings and resignations, and she said that, in fact, the president and the White House directed and backed Secretary Kennedy's moves. And I think it's important because, well, the president likes to tout Operation Warp Speed and the administration's response to the COVID pandemic. Ever since he began running in 2024 as a candidate with the endorsement and backing of Robert F. Kennedy Jr., he has sided consistently with him. And even in the week leading up to the 2024 election, Chris, from the campaign stage, he said that Kennedy would be allowed to, quote, go wild in his administration on health. And when it came to vaccines, he said that he was going to let him do, quote, whatever he wanted to. That is exactly 7 months in the type of power that he has handed Secretary Kennedy. And despite questions of whether this is Donald Trump's actual position and whether he actually wants the CDC to operate in this way, time and again, he has given Secretary Kennedy that exact power. And even earlier this week at that cabinet meeting that Secretary Kennedy attended, President Trump brought up the idea of autism and the, quote, horror of it and asked Kennedy how that was going. Kennedy doubled down and said that his department has been studying autism and its roots, and he would be releasing a report in the coming weeks. And so this is, to the doctor's point, only the beginning of what this department has sought to do. And that is where we heard directly from Dr. Jernigan and Dr. Ori, the chief medical officer, concern about the allies within this department of HHS and what their intent is to do with the numbers and science that exist, in what they intend to present to the public, in whether a typical scientific integrity clearance process is going to actually be followed before they disseminate it largely.
Well, Brandy, speaking of letters, as Zeke did, and the promise that was made apparently in a letter to Senator Cassidy, RFK Jr. sent another letter yesterday, and the way I read it was that this is all fantastic. Let me read a little bit of it. Reform does not diminish your work, it strengthens it. The American people are ready to believe in this agency again if we show them that integrity, accountability, and science guide every decision. Together, we will restore trust. Was there a legitimate question of trust out there? And where does this leave the other folks who work at the CDC who may be troubled by it? But let's be realistic. Not everybody has the personal financial ability to walk away.
Yeah, I mean, that letter, I've been talking to about a dozen sources inside CDC, and the general feeling is, how dare he? How dare he? Another letter to us in the trappings of science, using the words of science, but that aren't scientific at all. When you talk about trust, overwhelmingly, the people inside the CDC, who they trusted are the people who just walked out the door. It is Jernigan. It is Dr. Dimitri, Dr. Oury. And so with those people gone, their question is, who will be the bulwark between us, the people, the staff scientists and the workers and the epidemiologists, and Kennedy, who has tamped down their work, who has stopped them from doing their work, who has stopped them from producing and communicating their work, and only seems to be concerned with this autism question that has obsessed him, and it's been his occupation for 20 years, proving this point. And so it's really, really sad inside the CDC right now. People do still have jobs. Hardly anyone is working, I'll tell you that right now.
Really? All right, which brings me, Dr. Emanuel, to this question of an autism report that could come within weeks. Who's going to write that? And by the way, the White House has named RFK Jr.'s deputy as the interim CDC director, a guy named Jim O'Neill, someone who has no medical experience.
Can I just say in one thing?
Yeah, of course.
Which is, or two things. First of all, I do believe through personal communications that Donald Trump also believes what RFK Jr. does about the link between vaccines and autism. I don't think this support is casual, and I don't think this support is something that he's just come to. He has a belief about it. He asked me personally about it. The second thing is Jim O'Neill is. Can
I ask you about what was his question?
Do you think vaccines cause autism? And I explained why that study in the Lancet that started this whole thing is wrong, retracted. But I don't think this alliance between the two of them is casual. The second thing I would say is Jim O'Neill is a political appointee. He doesn't, as you point out, he's an investor, but doesn't have scientific experience. He can stay there 210 days. I think Senator Cassidy is the critical player here to make sure that whatever is left of the CDC can be protected and it can rely on science. And I think he has said we're going to need more oversight. I think it's going to have to be more than just oversight. He is going to have to critically dictate what he thinks the CDC has to be, HHS has to do, and the secretary has to do to preserve the CDC. And I agree, the language that RFK is using is very Orwellian. It's using words in their exact opposite meaning, and that is really, really disturbing. That's a classic example of how people don't begin to trust anything when you say we're restoring science. We're not restoring science. He hasn't used one bit of data that has passed peer review and the community agrees to.
Dr. Emanuel, I know you have another commitment and have to go. I want to thank you for your important information there. Michael, let's talk about Bill Cassidy, the senator from Louisiana, who besides being the head of a key health committee, is a doctor, who's married to a doctor, who founded a community clinic in his home state of Louisiana. Is he capable of doing what Dr. Emanuel says needs to get done, to critically dictate what needs to get done? What power and will does he have, do you imagine?
So he's a United States senator. He's more than capable of doing exactly what Dr. Emanuel said. Will he? No, I don't think he will. There's not a Republican in the United States Senate has done anything in the last 10 years that would lead us to believe that in a moment like this, that they're going to stand up and say to the American people, we side with you. That's not. Why are we pretending that Bill Cassidy is going to do something different than any other action he's taken up till now? He voted for RFK Jr. in the face of RFK Jr.'s family saying, please do not put this crazy man in this job. And he voted for him. He got a piece of paper saying what? He believed that crap? Come on. Why do we play this game? This is not, we're expecting this man to do something that there is no evidence he's prepared to do because what? He doesn't want the wrath of Donald Trump on his head. He doesn't want to be outside of the MAGAverse. His Senate seat is valued less than his support for Donald Trump. The people in his state, their health and their concern is of less value to him, as it is for every senator who's voted for this guy, who voted for RFK Jr.
So
we can't
we're out of time, Michael, but I want to ask you,
because
this is the important question then. If all of that is true, and there's a ton of people who agree with you, what's the average American to do whose lives or their ability to have a good life depends on a functioning CDC and FDA?
Buckle up, baby. You're going to be sick. They're going to the explosion of measles this academic year in schools across the country is going to be we've seen what happened just in the first part of this year in places like Texas at the end of the school year. Now we're about to go into a whole new school year, and the idiocracy that's running our healthcare is saying, you know, children don't need to take have the vaccines that they need to protect themselves and other kids. So yeah, people are going to get sick. People will die, and people won't have access, as we've said up to this point, will not have access to the information they need to keep them healthy and to save their lives, because the data is BS. It's made up. It's not real. We all know what this autism report's going to say. You think after all of this, they're going to put out a report that confirms that there is no link between vaccines and autism? No, we already know the report's what it's going to say. And yet the press and the politics are going to pretend like this is somehow going to be news. They don't need to go study. What study? So I think Dr. Emanuel's right, you know, and you know, Dr. Jernigan and others who've been saying that the data is the key thing that goes a long way to keeping us healthy. When that is bad, when that information is bad, the consequences to the American people are bad. And so I don't know how you get around this. I mean, we can talk to Bill Cassidy, but Bill Cassidy is not going to do anything that Bill Cassidy hasn't done before because he voted for the man who's created this mess.